We start out with casts that are the final impression. They've been trimmed so that we've preserved the mucobuccal fold all the way around. And these are going to be the final casts that we use from now on until we process the denture base. The doctor is supplied with the centric tray. Very, very close to accurate bite registration as far as the upper and the lower in relationship to each other. The next thing that we're going to do is just exactly what we did on the upper, but on the lower we're going to identify the straightest area of the crest of the ridge. In other words, if you notice here, it's very, very straight, and then when we get to the retromolar pad and the metamolar pad, it kind of goes in. So, got my final, I'm just about ready here now. And now I'm going to go back, and remember we marked those frenums? So I'm going to go back and kind of relieve some of the material in those frenum areas that we identified. It's nice, it's pliable, so if I make a mistake, it doesn't really matter. I can just go back and push the wax wherever I want it at this point. So now it's pretty much representative of really what I want it to be in the patient's mouth. So now I'm just going to trim kind of my excess.
So all we're doing is staying a little behind the red line. If I bring it out too far, you're going to be too far labial. So I want to stay behind the red line, and I want to line it up to the midline. So I want the mesial to be at the midline. I also want the tooth to be standing perpendicular to the setup template. So I want it to be flat here in the front. The actual gingival third caves in automatically and turns in. But I want the middle third of the tooth to be straight up and down. I do not want it to be leaning, gingivally or incisally, just straight up and down. Wax for the next central. And we'll place the central. And we're going to use the mesial of the tooth and the labial of the tooth. And we'll slowly just come down. Okay, I want the upper lingual cusp to be fitting right in here in the central fossas of these two teeth. So it'll actually a 1 to 2 relationship. So it's 1 to 2 relationship. So it's going to be right here close in that marginal ridge area here. With the distal part of this tooth and lining it up with my line. So I'm keeping it, the tooth in the proper position. I'll go ahead and heat this a little bit. Slowly close the articulator. And of course you can, add a little more of the bleaching. You can add a little bit more of the red-orange color, according to what, how you want it to look. And so there's the finished product.